Hi, how are you? Welcome. It is the Nisha Jackson Show. I'm Rusty Humphries. She is Nisha Jackson, and we sure appreciate you being here. Nisha, you've been out and about, traveling the world. Where'd you go?
I was just down in Mexico, down the Baja. Had a great time. Got some sun, which is always good this time of year to get some sun, and had a great time. I did a slight little re-injure on my knee, so I get to see my orthopedic surgeon again, but I'm still moving. I hiked this morning. I have more pain than I'd like to have.
I was going to say, is it hurt?
Yes, yes, but that's what happens when you do crazy things. So I fell in the hole of my boat. I didn't realize
your boat has a hole. That's a bad start anyway, right?
I didn't realize the cover to the hole in the boat where you pull the anchor out of was actually open, and I stepped in it with my bad leg.
Oh.
I mean, I try not to say bad leg, recovering leg.
Yes.
Yeah.
Okay. That's that energy meditation, positive.
Manifesting.
You're manifesting no pain.
Bad leg stuff. So
manifesting good stuff.
Yes, it's going to be fine. I'm gonna come right back.
Okay, let's talk about vitamins. You talk about that a lot. Supplements is something you really believe in. There's one vitamin that really kind of sticks out. That's B12, right? Why is B12 important?
Right. So, I love talking about vitamins, and I always kind of get a little bit of a charge out of medical professionals today in the field that say to patients, you don't really need to waste your money on all those vitamins. They just go through your system. They don't really do anything. You can get enough just by eating a good diet. So don't worry about taking any extra vitamins.
I mean, what I hear is when you go to the bathroom, you see it's a different color. You're just wasting money right down the drain.
Yeah. So after 30 years of seeing patients, and my entire career, I've given B12 shots and a combination of different types of vitamin shots that I really believe in. I have seen the most dramatic things reverse for patients. I mean, I'm talking about depression, body pain, neuralgia, which is that prickly pain that you can get mostly in your lower extremities. Okay. We've seen anxiety resolve, sleep problems, hormone balance gets better when vitamins are optimized because it's all connected. So I just kind of get a little bit of a charge out of medical professionals not really giving enough support to how important vitamins are. So today I decided we would talk specifically about what happens in your body. What are signs of low B12?
Okay. And is B12, is it best to have a supplement, a shot, an energy drink? What is the best way to get your B12?
So the best way to get your B12, in my opinion, is a shot. It goes right into the muscle. You get 100% absorption. You don't have to go through your gut. Your gut doesn't have to try to absorb it. So if your gut's not really in good balance, which is a huge American problem today, you're really not going to absorb the vitamins as well as you should. So my personal preference is B12 shots or a combination of B12, B6, B5. Other B vitamins, but just because you get 100% of the absorption right away, you don't have to wait.
And it's not a super expensive shot either. I mean, there's a lot more expensive things out there, right?
Right. It's a great way to get it. The other way that I like to have the B12 shots is sublingual B12. So it's
under the tongue.
Yes, underneath the tongue. So I've had the same. I'll show it to you in a minute. I've had the same B sublingual supplement now for my entire career. I've had the same supplement, same company. It's a combination of B vitamins. It tastes really good. It's kind of a cherry flavor. It goes underneath your tongue. You need to eat first because vitamins do absorb better with food. Okay. I just love this supplement. So that would be my second choice for best absorption would be underneath the tongue. And then the third choice would be a capsule that you swallow. Okay.
So let's find out, how do I know if I'm low in B12 or not?
Yes. Okay. I just want to explain because these are pretty significant things I'm going to talk about. I just want to explain what are some of the signs of being low in B12. Unfortunately, what I'm going to tell you could be signs of other medical problems. And so certainly if you're taking B vitamins and you've had your level checked, because you can check your level in the blood, if you've had your levels checked and your B levels are good and you still have some of the problems I'm talking about, obviously you need to go to your medical professional and get checked out. So I'm going to put that disclaimer out there. Okay. First thing, numbness. So numbness or that kind of that weird little prickly sensation you have in your hands or feet, it can be a common side effect or symptom of low B12. Because what happens is that B deficiency, it causes a disruption in the sheath that your nerves run in, and it wears that sheath down. So then you get you're more susceptible to numbness and tingling. So that's one thing. And I can't even tell you, Rusty, how many patients I've seen that have had this prickly kind of pain or numbness feeling, and they don't know why. And so they're going to chiropractors, and they're going to massage therapy, and they're going into all these treatments, and they just need B12. So, and often it goes away. Another symptom is colder. Your body is colder than usual.
So every woman is low on B12. Because it seems like every woman I talk to are always cold.
Well, there's other reasons why you would be cold, like if your hormones are not right, your thyroid's low. I mean, there's other reasons, but B12 is one of them, because you need B12 in order to have healthy red blood cells. And healthy red blood cells carry the oxygen molecule. So in order to get oxygen to your extremities, this is kind of tied into the numbness too, you have to have enough B12 to make healthy red blood cells, which carry the oxygen molecule. So colder than usual is another sign of low B12. The other one that I think is probably the most predominant sign of low B12 is brain fog. And that's why I think people in our office, Rusty, get so much better when they use B vitamins. All of a sudden, it's like their brain turns on. It's like they don't have that problem with memory and concentration. They can focus. So the other issue with B12 deficiency with patients today, with people today, is they get depressed. And sometimes when you're feeling depressed, you can also feel like you're sort of in a fog, like you can't quite get it together. Right. So those are signs of low B12. Certainly, again, I want to say those could be signs of other things, but that's
maybe this is the first place to go to check on those things. Maybe do a quick B12 shot, see how that helps you.
Yes. B12 is also really important for your muscles. So if you're saying, gosh, it just seems like I have more weakness in my muscles. You're taking your B vitamins, aren't you?
Yes.
Those little sublinguals I gave you.
Yep.
So the ones I was just talking about.
Yes.
Okay. So weakness in your extremities. So if you feel, I mean, obviously you can have weakness in your extremities because you haven't been working out. And then when you try to work out, you feel not very strong. But if you have been working out and all of a sudden you notice that your extremities or your strength, you don't have as much strength as you've had in the past, that can be a B12 deficiency. Now, again, it could be something else, but wouldn't it be easy just to try the B vitamins first?
Sure.
I mean, you could try them for a couple of weeks and probably notice a difference. Or if you live close to a medical facility that does B12 shots or B combination, B complex shots, you could get one of those and just see how you feel after a couple of weeks. Because many of these things, Rusty, goes on for a long time.
And how quickly do you see turnarounds when you get a B12 shot? Is that something that's pretty fast, or does it take time?
No, it's actually very quick. Now, if your level is really low, you might not notice a difference the first time you get a shot. You might have to have a series of shots. So people who have autoimmune disorders, people who have they've been diagnosed with chronic fatigue, I usually recommend getting B complex shots 3 times a week for a month, which seems like a lot.
It does seem like a lot of shots.
But we're dealing with sick people here, right? We got to try to move their system. So 3 times a week for a month, and then 2 times a week for a month, and then once a week for a couple of months after that. And that really moves people quickly. I love what that does for patients who are really suffering, and it's worth it. It's worth getting them regularly like that. Also, I have a lot of patients. We're going to do a show, Rusty, on how to evaluate what's going on in your body by looking at your tongue. So a really smooth tongue, because your tongue is actually not supposed to be smooth, but if your tongue is very smooth and more smooth than maybe your partner's tongue or your kid's tongue, it could be a B12 deficiency. So that's just something to look at. if your tongue is very,
I've never seen that before. A smooth tongue.
Smooth tongue. I mean, you think about your tongue being smooth, but it actually shouldn't. It should have ruguet on it, and it should not be smooth.
Oh, okay.
Okay, and then one thing that I see all the time in my practice, all the time in all of our clinics in Oregon, is people who are vegans or vegetarians, which I'm not opposed to. I just think that some people do it irresponsibly, meaning they're not getting the right nutrients in and planning their diet really well, and they're just eating a bunch of carbohydrates. But you're very much at risk for B12 deficiency. So it's really important, if you are a vegan or vegetarian, that you're supplementing with B12 on a regular basis, because you are at risk in getting, number one, other nutrients, but primarily B12 because of not being meat eaters. So
now, if I just ate a diet of like Oreos and Snickers and stuff, that'd be vegetarian.
Right. So that is my concern, is that a lot of, I'm not generalizing right now, because there are wonderful vegetarian, vegan, plant-based diets out there that I love. But a lot of people do eat food like that because they're just trying to be responsible and not eat meat and not eat any kind of animal products, which I have my own opinion on. But anyway, they will substitute with a lot of sugar and starch in their diet, which is way worse for them.
Have you looked into that Impossible Burger, that Impossible Meat stuff?
No.
Okay. You know what I'm talking about, don't you?
No, I've not seen it.
Oh, it's a big deal. And like a Burger King and all kinds of places, they have a plant-based burger. It's called the Impossible Burger, and they say it tastes like meat, and I say it doesn't. But it's a big deal.
I haven't seen that, but probably because I don't really frequent a lot of these places.
You don't go to Burger King a lot? That's a shock.
I guess I didn't know about the Impossible Burger.
That's a big deal. All right. Well, maybe we should look into that one, for folks there, because it's like a big deal right now.
Yeah. Okay. Well, I'm going to check that out, and then we'll report back on.
There's another thing she's never going to do. Okay.
The other things that you can be at risk for if you have low B12, anyone that's had gastric surgery for weight loss, you're not probably absorbing the B vitamins as well as you should. And many people, the types of diets that they have after gastric surgeries for weight loss don't really realize, because they haven't been told or educated, that you need to be taking B vitamins. And those people, Rusty, should be getting shots. And they should be using the sublingual, because many times when you try to take a capsule or a tablet after a gastric surgery, you really don't absorb the nutrients and the vitamins very well. So that's another thing. There are a whole list of medications. I would just Google it if I were you. Esophageal reflux meds, a very common medication that many people are on right now called Metformin or glucophage.
I'm on Metformin. That's for diabetes.
Yes, it's for pre-diabetes and diabetes. So people who are at risk for diabetes or have high insulin or glucose instability might be on Metformin. And also, Metformin has gained a lot of popularity recently as an anti-aging medication. So we have identified that Metformin can reduce inflammation in the body as you age. And so a lot of people are on it just for anti-aging purposes. But Metformin can reduce your body's ability to absorb B12 and then put you at risk for all these awful things I'm talking about right now. So if you're taking Metformin, if you're taking esophageal reflux medications, and there's other there's other medications that cause B12 deficiency, and again, I would look them up. You might not be absorbing B12 as well as you should because it's interfering with the absorption.
Okay. Is there more?
No, that's enough.
A pretty good wrap up of B12.
I know. Well, I just really wanted to impress on people today, Rusty, that it's important to think about what you're getting in your diet. Lots of green leafy vegetables. My personal opinion is to mix in a really good steak every once in a while.
I'm with you there.
I think that's a good idea, but that's my opinion. And just making sure that if you're at risk for B deficiency, if you're pregnant, you should be supplementing with B vitamins, especially if you're pregnant and plant-based diet and not eating meats. You should be supplementing with B vitamins, and you can talk to your medical professional about that. But as we get older, we don't absorb these vitamins as well as we should from the foods that we're eating. And I don't really honestly believe that we can get enough of these vitamins in the foods that we're eating, because I'm going to take that back. most people don't have a perfect diet. They just don't. So let's be realistic and start supplementing with B vitamins, getting our brain chemicals to work better, our gut to work better, our tongue would look better, which is really important, don't you think?
Especially for Gene Simmons. And I had not heard a lot of people talk about B12. That's not something I hear a lot of. I mean, I see the supplement, but it's not like I hear a lot of people going, man, I got to get more B12 in.
Yes. And it's so easy to take, and it really does have a pretty dramatic effect on the body. And just a reminder, all of our brain chemicals are originally made, a precursor to our brain chemicals is B12. So it's impossible to make your brain chemicals without B12. So we have to have it in our diet, and we should probably be supplementing it, especially if you're getting sick often or have some of these symptoms I mentioned today. Or if you are suffering from an autoimmune disorder, you've had gastric surgery in the past, or any kind of stomach types of surgery, you should be on B vitamins, particularly B complex sublingually.
All right. All that is good information. The other thing you should probably be doing is picking up a copy of Brilliant Burnout: How Successful Driven Women Can Stay in the Game by Rewiring Their Bodies, Their Brains, and Their Hormones, written by her, Nisha Jackson. Also, don't forget to check out nishajackson.com. And no matter where you're watching us, whether it's on Apple TV, Roku, Fire TV, Google TV, Apple Podcasts, Google Podcasts, Facebook, whatever, subscribe, share, like, tell your friends. We sure appreciate it. It means the world to us. And go to nishajackson.com to get more information on all of this stuff. So until next time, I'm Rusty Humphries and she's Nisha Jackson, and we'll catch you next time here on The Nisha Jackson Show.